Hello listeners and viewers. Welcome to Kaduna State Ministry of Education Radio and TV e-learning program designed for our SS3 and other students staying at home due to the coronavirus pandemic. The present administration, under the able leadership of His Excellency, Malam Nasir Ahmed El-Rufai, is positioned, as always, to ensure that under his leadership, our students are not left behind in all areas of human endeavors, especially education. Kaduna State is the center of learning. Therefore, we want to ensure that our students excel in their forthcoming examinations and beyond. Students and other learners at home are given this opportunity in order to continue learning, as education is a continuous process. Different subjects will be taught in this program to assist students to perform excellently in the forthcoming Senior School Certificate examination being conducted by NECO and WAEC as soon as schools reopen. Teachers making presentations will always provide their names and phone numbers during each presentation, and they can be contacted for questions, further explanations, and/or clarifications. The following numbers and contacts can also be reached for expression of any concern or observation: 090-865-00545 or 080-383-62072. Our website is www.education.kdsg.gov.ng. Our email education@kdsg.gov.ng or education.kdsg@gmail.com. Our YouTube channel, Ministry of Education, Kaduna State. Our Twitter handle @Kaduna_MOE. Or our Facebook page, Ministry of Education, Kaduna State. Stay safe, stay at home, and learn well. Thank you, happy listening, and happy viewing.
Good day, learners. You are welcome to another segment of Agricultural Science. My name is Rashida Umar. Our topic for today is Animal Health Management. In our previous lesson, we have started discussing about animal health management, where we have seen the terms used in this topic. We have seen the meaning of disease, meaning of health. We have seen factors that predispose animal to disease. We have seen the differences between resistance and susceptibility. You also move further to look at the sign in animal disease. After that, we also look at the causes of disease, which we said the pathogens that causes disease are virus, bacteria, fungi, and protozoa. So due to time constraint, we are not able to finish our lesson. Today, we are going to continue. So today, we are going to talk about the common disease in livestock. So today, we are going to look at the common disease in livestock, summary, and assignment. My dear student, please don't get confused if you see this word livestock. Livestock, it simply means farm animals. It's another word for farm animals. So the common livestock disease we have, starting from the first one, which is foot and mouth disease. We are going to look at the names of the disease, the causative agent, animals affected, symptoms, effect, and mode of transmission, and also control measures. The first disease is foot and mouth disease. The causative agent is virus. This foot and mouth disease is caused by virus. The animals that are being infected with this foot and mouth disease are cattle. Symptoms. Symptoms of foot and mouth disease are sore of feet, lips, tongue, inability to eat, lameness, and death. This simply means the symptoms that will make you to easily identify that your animal is being contacted with foot and mouth disease are sore of the feet. You will notice some sores on the feet of the animal, on their lips or tongues, or inability for them to eat well. The animals will not be able to eat well. Or lameness. This lameness, it simply means they cannot walk well. The animals will be limping. Mode of transmission. This foot and mouth disease can be transmitted through contact with the infected animal or by contact with the contaminated feed or materials from the head. It simply means if the healthy animal comes in contact with the infected animal, the disease can easily be transmitted, or contaminated feed. Effect of this foot and mouth disease is serious loss of animals through death. Mostly the animals that have been contacted with foot and mouth disease, their effect is serious loss of animal. The animals die sudden. You just experience or you notice sudden death in your head. Control measures. The only way you can control this foot and mouth disease is by inoculation of vaccination, or you isolate the diseased animals, because this disease do not have treatment. It has no treatment, so you have to isolate the infected animals from the healthy ones, or you inoculate vaccination to the animal before they are being contacted. But once they are contacted with this disease, there is no cure, no treatment. The second disease is rinderpest. Rinderpest, the causative agent of rinderpest is virus. It is caused by virus. Animals that are affected is cattle. Symptoms of this rinderpest is high fever, blood stains stool, difficult in breathing, and animal grind their teeth, and the death rate is high. Here, when you notice that in your animal there is high fever, or you notice some stain of blood in their stool, or difficulty in breathing, that is if they are finding it very difficult to breathe, or if you see the animal grinding their teeth, it means they are being infected with this rinderpest. Mode of transmission. This rinderpest disease can be transmitted through direct contact with the infected animal and eating contaminated food. When the animal eats contaminated food, or they come in direct contact with the diseased animals, that is how they get transmitted. The effect of this rinderpest disease is death. Mostly, once the animals are being contacted with rinderpest, they will just die because it has no treatment. Control measures. The only control measure of this rinderpest disease is by inoculation of vaccine. You have to be giving them vaccination before they are infected, because once they are infected, there is no treatment. So you have to give them vaccine against the rinderpest before they are being contacted. So once the animals are being infected, what you do is just you kill them, slaughter it, and bury them deeply so that they will not infect the healthy animals. The third disease is Newcastle disease, which is also known as the NCD. The causative agent is virus. Animals that are being infected with this disease mostly are the poultry. Symptoms: drop in feed intake, severe respiratory difficulties, neck twisting and paralysis of the legs, laying of soft shell eggs, watery greenish diarrhea. This Newcastle disease, their symptoms is you will notice that the animal will not be eating well. Also, they will be having severe respiratory, that is, they will be finding it difficult to breathe. Their neck will be twisting. Sometimes when you observe very well, you see that your poultry, their neck, they will be twisting their neck upward. It is also another sign of Newcastle disease. Or they will be laying, the layers will be laying eggs that have very soft shell. That is another symptoms of this Newcastle disease. Mode of transmission is through contact with the feces of infected bird. These birds, when they come in direct contact with the feces of the infected bird, or in contact with the nasal or the oral discharge from the diseased animal, they can easily be contacted. Effect: low egg production in layers and high mortality rate resulting in death of the animal. Mostly, if these animals are being contacted with such disease, they have low production. They will not produce well. Control measures. Control measure of this Newcastle disease involve inoculation of vaccination using freeze dried NCD vaccine, giving either intraocular in young bird or intramuscular in the older bird. This intraocular vaccination, it simply means the young bird, you will give them the vaccination through their eyes. You have to drop it in their eyes. That is what is known as the intraocular. While the intramuscular is injecting them through their muscles. The fourth disease is chronic respiratory disease, that is the CRD. Causative agent has not been identified. It can either be virus or bacteria, but it has not yet been identified. The animals infected mostly are the poultry. Symptoms: you experience or you notice nasal discharge, rattling sound during breathing or loss of weight. You see some discharge from the nose of the animal, or their breathing will have sound, some rattling sound, or loss of weight. Mode of transmission: through contact with the infected bird and the nasal discharge. When the animal comes in contact with the nasal discharge of the infected animal, they get infected. Effect: lower production in bird and also loss of birds. The effect of this disease is that they will not produce well and they will also be dying. You will start noticing some sudden death in your head. Control measures: good sanitation, uses of antibiotics, consult a veterinary doctor. The only way you can control it is by what? Use of vaccination or use of antibiotics. Number 5, brucellosis. This brucellosis is a name of disease which is also known as the contagious abortion. The agent, causative agent, is bacterium. My student, please don't get confused if you see bacterium. Bacterium, it simply means when it is single, and the plural form is bacteria. Animal affected mostly are cattle. Symptoms: premature abortion, stillbirth, retention and of afterbirth, inflammation of womb, infertility in male animal. The symptoms of this disease is that mostly it have premature abortion. That is, the animal normally give birth before their time. For example, in the pig, we have 3 months, 3 days, and 3 weeks and 3 days of between conception and parturition. But when the animal gives birth before the identified or the certified date, it means it has premature. It gives birth to the baby when the baby is still not matured. We have stillbirth, that is giving birth to the baby not alive. Retention of afterbirth is another one, and inflammation of the womb. Also, in male animal, you will notice infertility. Mode of transmission: contaminated feed, water, and infected animals. The disease can be transmitted through contaminated feed or water. Effect: loss of fetus. The disease is zoonotic. When you see the word zoonotic, it simply means this disease can be transferred from the animal to human. So this disease, it can be transferred from animal to human. Control measures: vaccination, or you report any occurrence to the nearest veterinary officer. Number 6 is anthrax. Anthrax is another name of disease. The causative agent is also bacterium. Animals infected are cattle. Symptoms: blood ooze from the mouth, nose, and anus of the animal. Symptoms of this disease is that you see blood will be coming out of the nose or anus of that animal, or you will notice sudden death in your animal, or swelling in the lower abdomen of the animal. Mode of transmission: through contact with the infected animals and their product. Effect: loss of animal. It is also zoonotic. This disease is also zoonotic. Most of these bacterial disease, they are zoonotic. That is, they can be transferred from animal to human. Control measures: vaccination, born or very deeply diseased animal, disinfect properly after disease has occurred in a head. You are supposed to give them vaccination, that is before the occurrence, And once it happens, you burn and bury the diseased animals so that they will not infect the healthy ones. And also, after doing that, before you now stock another animal, you have to what? You have to disinfect. You have to disinfect properly before stocking animals. Tuberculosis. Tuberculosis is another disease. The causative agent is also bacterium. Animals infected they occur in most animals. Mostly this tuberculosis happens or occurs in all animals. Symptoms. Symptoms of this tuberculosis, it infects lungs, constant coughing, emaciation, and finally death. You notice that the animal will be coughing regularly and they will be emaciating. They will be reducing in size. That is loss of weight. Transmission through inspiration of germs, contaminated water, feed, litters, and droppings. Effects. Lowers productivity and also result in loss of animals. This disease is also zoonotic. As I earlier told you, most of these bacterial diseases, they are zoonotic. That means they can be transferred from the animal to human. Control measures. Good hygiene, vaccination, kill infected animals, and bury deeply. You are supposed to be cleaning their environment regularly. And before contacting this disease, you are supposed to be giving them, to be inoculating them with vaccination. And once the animals are infected, just kill them and bury so that they will not infect the healthy ones. Because this disease in animals does not have treatment. It has no cure, no treatment. The next disease is fowl typhoid. The causative agent is also bacterium. Animals affected are poultry. Symptoms. Birds becomes weak and yellowish diarrhea. When you start noticing diarrhea with yellowish color in your bird, it means this disease is being affected with this fowl typhoid. And the bird will also become very weak. Mode of transmission, contact with the dropping from the infected bird or contaminated food. When the animal, the healthy ones, come in contact with the droppings of the contacted animals, they transmit the disease. Effect. The effect of this disease is loss of bird. Most of the birds, they will just be dying. You start experiencing sudden death in the poultry. Control measures. Vaccine, proper sanitation, contact a veterinary doctor. Before this disease happens, you can what? You can give them vaccination. And after it has happened, you have to do what? You have to contact your veterinary doctor or veterinary officer. The next disease is ringworm. Causative agent of ringworm is fungus. My students, there is something here that I want you to understand. We said fungus because it's singular. When it is in plural, we said is fungi. So the causative agent here is fungus. The animals affected are all animals and birds. All animals are birds, and birds can be infected with ringworms. Symptoms. Symptoms of ringworm. Lesion on skin of farm animals, skin irritation, loss of appetite and weight. When this ringworm happens, you will experience or you will notice some lesions on the skin of your farm animal, or you will see them scratching. The animals will try to scratch their body. That means there is what? Irritation on the skin. They will start losing appetite, and also there is going to be loss of weight. Mode of transmission. Fungi is usually spread from infected to healthy animals. This disease is normally spread from the what? Infected to healthy animals through direct contact. That is when the animals comes in direct contact or their body touches one another, they easily get infected with this disease. Effects. Results in loss of hair in animal, resulting in lower market value due to poor appearance of the animal. When it happens, the effect is that you notice loss of hair on the body or on the skin of the animal. So, and that will result to what? To poor market. Everyone that goes to market to buy animal would like to buy healthy one. So once the hair is not complete, it what? It resulting to low market value of that particular animal because of its appearance. Control measures: maintain clean condition, isolate infected animals, treat with iodine or mixture of sulfur and Vaseline as surface dressing. Please, if you notice this disease on the body of your animal, what you will just do is for you to get iodine. You mix it with sulfur, then you apply it on the body of the animal. Please, outside dressing. You are not supposed to give it to intake, no, but you just apply it on the that is surface dressing. The next disease is Asparticulosis. This Asparticulosis is the name of disease that its causative agent is also fungus. Animals affected are cattle, birds, pigs, and poultry. Symptoms of this disease is abortion in cattle, loss of appetite and weight, difficult breathing in poultry. That is, in cattle, you will notice what? Abortion and loss of appetite in the animal. While in poultry, you will notice difficulty in breathing. Mode of transmission is air. This disease is airborne disease. So it's air being contaminated and feed, molded feed. Once the feed of the animals are molded and the animal consumes that food, it can also cause this Asparticulosis disease. The effect: reduce production and may result to death. Effect of this disease is that it might lead the animal to reduction in production, and also it can lead to death of the animal. Control measures: avoid molding feed as well as crowdedness in your head. You should not overcrowd the poultry pen, and you should also maintain cleanliness, because this disease has no treatment. Once your animal is being infected with this disease, it has no cure, no treatment. The next disease is the Tripastronomiasis. This Trypanosomiasis, its causative agent is protozoa, and it affects cattle. Symptoms of this disease is rise in temperature, anemia, sleepiness, loss of weight, and finally death. You experience or you notice that the body of the animal there is going to be rise in temperature. Also anemia, that is loss of blood, and the animal will also be sleeping regularly. They will be sleeping, and they will have loss of weight. Mode of transmission: the disease is spread by blood-sucking tsetse fly, which may suck blood from an infected animal and transmit to the pathogens to the healthy animals. There is a fly known as the tsetse fly. So once it now sucks the blood of the infected animal, it is going to transfer that disease to what? To the healthy animal. Effect: drop in level of production and death. Control measures: clearing of bush around the farm in order to remove flies' habitat. You are expected to be clearing the bush around your farm so that the tsetse fly will not have habitat or hiding place. Remove the flies' habitat: spraying insecticide to kill vectors. You should also be spraying insecticide so that you will kill the vector, which is known as the tsetse fly. Treatment: you treat infected animals with drugs such as Tripastronomiasis. If they are being infected, there is a drug known as the trypanosomide, so you can treat your animal with that drug. The next disease is Cocidiosis. This Cocidiosis is being caused by protozoa. Animal infected is poultry. Symptoms: dropping in wings, loss of appetite and weight, blood-stained diarrhea, rough feathers, and high mortality. Mode of transmission: contaminated feed and water from dropping of the infected bird. Effect: drop in egg production and death of bird. The control measures is infect poultry house before stocking properly. You are expected to disinfect your poultry before you stock birds. Sanitation, use of suitable drugs, for example, sulfometazole or amprolium in water. Now, students, we have come to the end of this lesson. So let's look at the summary of the lesson. We have common viral disease in livestock, which include foot and mouth disease, rinderpest, Newcastle disease. So the common bacterial disease in livestock are brucellosis, anthrax. Brucellosis is also known as the contagious abortion. Common disease in fungi involves ringworm and asparticulosis. Now, students, before I go, I will leave you with this assignment. Question number 1, state the causative organism and 3 symptoms of each of the following livestock disease. A. Brucellosis, B. Tuberculosis, C. Asparticulosis, and D. Cocidiosis. I repeat again, state the causative organism and 3 symptoms of each of the following livestock disease. A. Brucellosis, B. Tuberculosis, C. Asparticulosis, D. Cocidiosis. You can send your assignment, or if you have any question to ask, through this number 080-34-51-35-76. I repeat, 080-34-51-35-76. Stay home, stay safe, and keep learning. Always remember to wash your hands with running water and soap. Thank you for listening.